caring for the health of your family, it is really the most important thing that you can do.
And for some families, that means having a family doctor.
Dr. Allison Fabian of the Spectrum Health Medical Group is here to talk to us about the importance of having a family doctor. So let's just start at the beginning. Explain, what is a family doctor?
Well, a family doctor is somebody who is able to care for, like the name implies, your entire family. So from infancy to your elderly grandparents.
You know, it's interesting. It's kind of a blast from the past. I mean, I remember when my mom was a little girl, they had Dr. Painter. He was the one guy that did kind of everything from deliver the babies to take care of them. And it really is kind of bringing medicine back full circle.
It is. I think less and less primary care doctors are doing the deliveries now, but, you know, we are seeing the babies the week after they're born.
Right. You know, what are some of the advantages to having a family doctor as opposed to saying, okay, we've got a pediatrician and we've got someone that, you know, is going to take care of grandpa? You know, there's got to be some kind of real nice, you know, advantages.
I think one of the benefits is that your family doctor understands the family dynamics. You know, they're seeing your son and daughter, and then they're seeing the parents, and then even in some cases the grandparents as well. So they understand what's going on in the family. They know your family's medical history. So for inheritable diseases, you know, they have that background.
And it sounds like, too, because your mental health is really such an important part of your overall physical well-being, a family doctor would be able to help connect those dots, too.
That's true.
It's a relationship with the whole family. You had brought up a really great thing because there's so many things, you know, you say breast cancer. And to know that family history also when you're treating people, is that relationship what makes it so special and being able to have that history of all the people in the family?
It is. And I think your primary care, your family doctor is really at the forefront of taking care of preventative diseases, doing cancer screenings, and even things like diabetes screenings.
Yeah, and kind of staying on you about it, too, because sometimes, you know, we don't always want to go and have certain tests done,
right.
But if you know the family well,
right.
You know, what a relationship to have.
You know, and you really think about what a great opportunity that is, too. You know, say you know, the wife is in for her appointment. Well, my husband's been having this back pain, and then you can really kind of share that information, too.
Yeah, Dr. Fabian, what was your reason for getting into, I mean, there's so many choices now for, you know, students of medicine and to go into the medical field. Why did you want to become a family doctor?
Well, one reason, you know, I like you go into one room and see a baby, and the next room maybe a cold or a flu, and the next one is something entirely different. So the diversity in what you're treating, and then also it is geared towards more of a family lifestyle. I'm a mother of a toddler, and so it's nice to be able to have the daytime hours and then have the evenings with my family.
That is really nice. Now, do you see, kind of put on your visionary hat here, is this really the wave of the future when it comes to medicine?
You know, patient-centered medical home is kind of in the forefront of everybody's minds right now, and what that is really putting the patient at the center of the medical treatment team, and guaranteeing open access, so same-day appointments. So that's, you know, really what we're looking at.
Oh, that is wonderful. Well, I know that is something, it is be kind of nice and to be able to, you know, talk and say, oh, I have a question while I'm here about my father, or I have a question about my child too, and so a lot of advantages to that, and so we're going to hook up your information to our website, and so anyone that has any questions can contact you and your medical group firsthand.
Yeah, that sounds fantastic. Thanks so much for joining us today.
Yes, thanks. We'll be right back.
That's West.